Hi, and welcome back to Body Beautiful. I'm Janelle Marie. Today we are talking with plastic surgeon Dr. Joseph Mealy about all kinds of procedures. And our final procedure, Dr. Mealy, is breast implant removal.
Removal, yes.
All right, so first off, why would anybody want to remove breast implants?
A fair question. It turns out about 1% of women end up having their breast implants removed.
Okay.
Mostly it's volitional. So a lot of people, they've had their breast augmentation, they were happy with the size, they get a little bit older, sometimes they gain a little weight and their breasts get bigger, and they're just done with that size and they want them removed. Other times there's problems. So people can get capsular contracture, you can get discomfort with them, and those are other reasons why we remove them.
Let's look at the pictures. First picture, what's going on?
So this is someone that had a very nice result, was very happy with her augmentation, but just got to the point where she didn't need them anymore. Maybe she's very active. People who are athletes sometimes do better when they have smaller breasts, but she just felt like it was time to get rid of them.
And did you have to do a lift after you take the implants out?
In this case, I did not.
Okay.
So her nipple is pretty central before, and afterwards it's still above that fold underneath. So I think for women who have smaller implants, who have tighter skin, who have more natural breast tissue, the results tend to be better and it's less likely that we need to do a lift.
And less recovery time.
Exactly. Recovery time for this is just a couple days normally.
Not bad.
If someone's having a lot of pain, I want to see him and see what's going on.
Picture number 2.
So this is someone who had relatively small implants, but again, was done with them. She had a little tightness of the implant on the left side.
Okay.
You can see the upper pole of the implant a little more prominently on that side. And the discussion would be whether to do something about that to make it smoother, change size, go down in size, bigger. We always have this discussion each time. In her case, the best solution was just to remove them, and then she doesn't have to worry about having future surgery to keep her implants happy.
The removal looks good and, you know, doesn't look like that much difference anyway.
And for her, it's not dramatic.
Yeah,
not clothing's going to fit very similarly, so not a lot of changes need to be made.
And picture number 3?
Same idea here. So this was fullness from a breast implant, just wanted it smaller.
Wow, so just took the implant out right there.
Yes.
And
still has a good amount of breast tissue.
Yeah, now did you have to do a lift on that one?
Again, did not do a lift on this. I don't think I did lift on any of these.
Oh, okay. Wow.
Yeah.
So that was just taking the implant out?
Just taking the implant out. And if someone's borderline, like they might need a lift, they might not, usually I will recommend just taking the implant out, letting everything shrink up, and then evaluate whether to do a lift or not.
Now, and in these cases, did you have to put the patient under?
Yes, so if someone has a silicone implant, I always do it under anesthesia.
Okay.
Because sometimes when the silicone leaks, it's harder to clean up, especially if it's an older implant.
Oh.
Implants after about 94 tend to be a lot easier to clean up. Saline implants also can be removed more easily, so sometimes I can do that under local, but I also want to remove some of that capsule. And I want to be sure someone's comfortable enough that if there's something weird in the capsule that has to go, I'm able to do that in the one operation.
And the final picture, let's take a look at picture number 4. While I ask you, a lot of people do have them removed because of problems with the implants.
Well, this is someone, she's only 6 days after her surgery.
This,
you can see the little tapes underneath. So again, we were talking about recovery. Recovery is very quick with this. Most patients in a couple days, they're fine, they're back to normal. Because really, I'm just sneaking in there, finding the implant, pulling it out, and not having to disturb much of the natural normal tissue that's there.
And she had a very small implant to begin with, am I right? On that one, it looks like it, right?
Probably 300 range.
Oh, 300 range? Okay.
Yeah.
And
so
just took
kind
them
of
out.
a little below average, but just about an average size. For her frame, it was an average size implant.
All right, that sounds good. Thank you so much for talking with us today, Dr. Joseph Mealy. Now remember, if you want to see any of these before and after pictures, all you have to do is go to the websites drmealy.com or sanfranciscobreast.com. And if you want to call the doctor's office, just give them a call at 925-943-6353. Again, sanfranciscobreast.com or drmealy.com. Dr. Mealy, thank you so much for joining us on Body Beautiful.
Thanks for being here.
Happy holidays to everybody. We've had a great time hanging out with you, and we will see you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.